Hi there, RAs. Today we are going to talk about managing difficult situations. So get jazzed up and get ready to learn how to confront any situation you might come across. We have 3 learning outcomes we hope that you get out of this presentation. First, define what a difficult situation really is. Second, address policy violations by using assertiveness skills. And lastly, address more sensitive situations using listening skills and referral skills. What is a difficult situation, you might ask? For the purposes of the RA position, we define a difficult situation as any incident that might involve conflict, high emotion, tension, policy violations, or documentations. Here are some examples of difficult situations you might come across. However, this is not all of them. Alcohol and parties, quiet hours and noise violations, illegal drugs, uncooperative or belligerent residents and guests, medical transports, sexual assaults, mental health, stress, and depression, eating disorders, roommate conflicts. Each of these situations are unique and varies with the circumstances and people involved. However, there are some strategies you can use to effectively navigate these difficult situations. We'll go over those next. There are 2 different types of categories that we can really break difficult situations into. First, assertiveness and documentation. Second, are situations that involve more sensitivity and listening skills. Let's break down those 2 categories. There are some key points to remember when thinking about assertive behavior and communication. These points are using effective communication about your needs and expectations, being respectful of others but not always supporting their behaviors, remaining fair and consistent, meaning not giving your friend the benefit of doubt without hearing both sides of the story, or making sure that you are treating all residents the same, using a clear and calm tone of voice, keeping eye contact with the persons you are speaking with, and always demonstrating an appropriate physical stance that is straight towards the person you are talking to. Assertive behavior and communication is not raising your voice or yelling at another individual, being disrespectful, threatening, or manipulative to the residents, being any sort of violence, physical or verbal, ignoring or avoiding confrontational situations. Now that we know more about what assertive behavior and communication looks like, let's look at what confrontation is. Confrontation's definition, according to Webster's, is a meeting of persons face to face, an open conflict of opposing ideas or forces. As a resident assistant, you will encounter various types of confrontational situations. One of the most common is policy violation and documentation. Let's look at the steps of documentation. You will encounter uncooperative people in this job on a regular basis. Your most valuable tool is your confidence in how you approach these difficult situations. Being polite, firm, fair, and consistent while maintaining your cool will help you diffuse difficult people and more likely prevent a hostile situation from arising. Our expectation is that no matter how difficult a person and situation may be, that staff never resort to any behavior that will escalate it into an aggressive or violent situation. You should never curse or threaten anyone and never strike a person in anger. If you ever feel for your safety while you're at the front desk, pull the Duress alarm, which will sound for ULPD, and an officer will dispatch to your location immediately. In other locations in the building, find the closest open door and use the phone. Whenever in doubt about your safety in a situation, call for backup from another staff member or ULPD. If you are dealing with an uncooperative resident, we recommend you follow these steps. Identify yourself, and if you don't know it, ask the resident's name. Use their name in the discussion as frequently as it is acceptable. Explain the problem with their behavior and ask them to cease it immediately. Explain how this problem does not have to be blown out of proportion if they are willing to cooperate. If the resident refuses to cooperate, remind them that it is part of the housing policies found online and their agreement to abide by it. If the resident still refuses, tell them that you might have to contact the professional level staff member on call or ULPD if appropriate. If the resident still refuses, contact
If the uncooperative
professional
person is a
staff member on
non-resident,
call
we
or
recommend the same
ULPD
steps
if
as
appropriate.
above, with the following
Document the situation
exceptions.
in
If
an
the
online
non-resident
report
continues to
form
refuse to
once the
cooperate,
situation
let
has
them
calmed
know
down.
that you will contact campus police.
The word police can make them cooperate more quickly than using ULPD if they are not familiar with that title. If they still refuse, contact ULPD and the professional level staff member on call. Next, let's look at the steps of documentation. The first step of documenting policy violations is for you to know and understand the policies. If you don't know the policies, how would you be able to enforce them fairly and consistently? Second step is always to announce yourself and introduce yourself. When knocking on the door, always say, "Housing staff." When someone answers the door, introduce yourself as, "Hi, I'm the RA on call. My name is blank." Next, address the policy violation. Tell the resident what you observed to stop and knock on the door. Remember to focus on the behavior, not the person. "I am just stopping in because I heard a lot of noises and what sounded like bottles clinking." Next, explain the policy violation and how to correct it. Use your assertiveness skills to be effective in communicating this. Collect necessary information from residents and guests in the room. ID numbers, names, etc. Once you've gained all the information you need, explain the process from here to the residents. Tell them that the hall director or RLC will be in touch. Next, you will document and report to your supervisor as appropriate. We will be learning about that process coming up. The consequences are now out of your hands as an RA. Never try to speculate or guess what the outcome or the conduct meeting will be like. It's really important to remain calm through the entire process. Remember to keep your voice as clear as possible, as well as being firm, calm, and not aggressive. If any time the situation escalates beyond what you can control, remember you can always call another RA, ULPD, or pro staff member on call. Now that we've covered situations requiring assertiveness and confrontation, now let's move on to situations requiring sensitivity and active listening. Some situations, such as a resident being homesick or stressed about school, don't require assertiveness, but instead require sensitivity and active listening. These situations fall outside of what we think about as a typical conduct or documentation instance, but utilize some of the same skills. Here are some tips for managing sensitive situations. Make sure to actively listen to what the resident is saying. Sometimes they just need someone to listen to them. Don't interrupt. You may feel like you need to jump in with some sort of assurance, but let the resident tell you what he or she is thinking or feeling. Don't make assumptions. This may make the situation worse because the resident may think that you are ignoring the problem, assuming that they are being dramatic or trying to diagnose them. Be curious and ask questions. Asking direct and clear questions can help you get a better sense of what is going on with the resident and will allow you to determine what the next steps might be. Don't promise confidentiality. Residents may come to you with serious issues that they don't want anyone else to know about. But before too much information is shared, let the resident know that you might have to let your supervisor know about this conversation. Don't try to diagnose or become a counselor. No matter how many psychology classes you have taken or experiences you may have had, you might offend the resident, or more importantly, you might be wrong. In serious situations, counseling professionals may be the best help. Trust your gut. If you feel like there is something more going on, you're probably right. Refer the resident to the appropriate resource, starting with your supervisor. Always ask for help. If you feel like you're over your head or aren't sure what the next steps are, don't hesitate to call another RA or the professional staff member on call for backup. To recap, we've defined a difficult situation. We've addressed policy violations using assertiveness skills. We've helped you understand how to address more sensitive situations using listening skills and referrals. No questions? You've got this down? You can handle any situation that comes your way? Probably not. We've only given you tips and tricks, but every situation is unique. The professional staff members within the residence education team want to be able to answer any of your questions. We know that there will always have questions that come up. Please never hesitate to ask.